I am struggling to find a surgeon to offer me tattoo excision. Is there a reason why it's so hard to find? I said, yes, I see this a lot. What is it about tattoo excision? Why would surgeons not do it? Now, as far as I don't understand, I really don't understand why surgeons would do it. I know we see people, so what is it today? Tuesday. So last week, I operated on someone on Friday. I can't remember what day. Anyway, I operated on someone from Switzerland and from Norwich. Well, I should have said Norwich first. Norwich, because Norwich doesn't sound so good when you say it after Switzerland. I operated on someone from Norwich, and Norwich is quite far from Birmingham and Switzerland. So both tattoo excisions from people from that far away. And I always say, look, go close. And I think they'd all seen people close, and they'd seen surgeons, and the surgeons told them, they'd said they wouldn't do it, or they couldn't see what the problem was, or it wasn't worth it, or whatever. I don't know what. So I don't know why. I can't talk for other surgeons, and I don't know why. There does definitely seem to be a reluctance amongst surgeons, plastic surgeons, to do tattoo excision. I think a lot of people talk about skin grafts, and similarly, like I say, with the lip, on the limbs and things, skin grafts do not look good. They do not look like normal skin. So personally, I don't like the option of skin grafts to tattoos. So there's only a small proportion of tattoos that are suitable for excision, those that can be closed directly, even if it's in multiple sessions. You might need to go back a few months later and do another session. But I seem to have quite a lot of people who ask for it, who come from quite far and wide, which is kind of good. But I always say, look, go local if you can, because if you have any issues and things, it can be a bit of a nuisance if you're far away. Obviously, you've got phones and videos, and we can talk to you and liaise with the GP if you need antibiotics or anything like that. But it's not ideal. It's ideal to go local. But I cannot answer the question as to why a lot of plastic surgeons won't offer tattoo excision. If there's any plastic surgeons on the line, if you want to offer your opinion and say why you would or wouldn't do a tattoo excision, I just look at it like a mole or a lesion, and we remove bits of skin all the time, and it's just basically removing a bit of skin and stitching it up. So it's a relatively straightforward thing for me, for the right tattoo. And that's the like anything, it's about patient selection. I'm talking about Haley, it's about selecting your patients right, counseling your patients, telling them what to expect. And I often say to people, quite frankly, cosmetically speaking, the scar can look worse than the tattoo. If you've ever seen my videos on tattoo removal, people sometimes do comment to that to that degree by saying the scar looks worse than a tattoo. And I'm like, I've often told the patient the scar's going to look worse than a tattoo, but for whatever reason, they don't like the tattoo and they are happy to accept the scar. So it's all about counseling preoperatively. And if you're happy to accept the scar, it is an instant result. There's no question about whether it's going to work or not. So, you know, there are lots of positives about excision. It does definitely get rid of it, but I don't know why surgeons don't do it. I can't answer that, but I do know that I do it. So if you've got a tattoo, call me, WhatsApp me, send us a photo, and we will have a look at it and give you an idea of what can be done if we can help you.